one of the things that I think, I suppose I wanted to start by was to take a view about why this has been, this whole question about encouraging people to come and work in the field of mental health has been a problem. And in my view, there have been two really major issues which we now need to overcome. The first question has been this whole issue of stigma around mental health. And the stigma that surrounds mental health as an issue doesn't just affect those people who experience mental health problems and their families, but it has also historically extended into the profession itself. So people have not felt as though working in mental health services has necessarily been a particularly attractive route to go down. And the second area, and I think we've just heard a little element of this, has been a kind of real ignorance around mental health, around it as an issue, around what working in mental health professions looks like, around the idea that you can have a career in mental health, and indeed the idea that it would be rewarding and challenging. And so those two very significant challenges have, I think, played an enormous role in acting as a brake, as a barrier, as a problem to encouraging people to come and work in this kind of environment. And I like to put my hand up and say I was probably one of those people a few years ago who hadn't seriously thought about working in mental health until something happened to somebody very close to me at college, until I started to try to understand a little bit more about what mental health was all about. And the rest, as they say, is now history, nearly 30 years of working in this sector. And I suppose one of the reasons why I'm very supportive of this initiative is because I think its time is right. I think we are now absolutely beginning to see the stigma around mental health issues shift. We've seen public figures, not just Alistair Campbell, but people like Stephen Fry, like Lord Stevenson in the room today, talking openly about their own experiences. We know from the Time to Change campaign funded by the Department of Health and the Big Lottery Fund and Comic Relief that public attitudes around mental health as a subject are beginning to change for the better. And that's a hugely important context in which to bring this conversation into play and to make it live. We also know that there is a growing interest as that stigma starts to lift. One of the audiences, one of the groups of people where that stigma is beginning to lift at the fastest pace is younger people. And in fact, there are now 55 university-led, student-led mental health groups up and down the country, led by students, often with their own experiences of mental health problems, often wanting to try to tackle the stigma of mental health in their own, on their own campuses, in their own environments. And that interest is growing all the time. So we have a growing cohort of people for whom the idea of working in mental health as a profession shouldn't be quite such an alien concept after all. And as we've already heard, we've also seen the start of the success of other initiatives. And there are certainly some areas of the mental health workforce where we're beginning to see large numbers of people wanting to come and work in mental health. And I'm particularly thinking about people who do psychology degrees, where there is a huge waiting list for people who then want to go and do clinical psychology as a profession. Now, this programme is not about increasing the number of clinical psychologists, but I suppose we should note that pool of people who want to and actively want to think about working in mental health and working with people who experience mental health problems. So there is a sense that there's a pool of people who want to do that. And for those people who, for whatever reason, can't get on a clinical psychology course, what do they go and do? They almost certainly go and become accountants. And you know, that's slightly depressing from my point of view in terms of wanting people who are great people who want to come and work in this sector, who, for whatever reason, at relatively young age, decide that that's not for them. Most people who work in mental health tell me how challenging, yes, how frustrating, yes, at times it is, how difficult it can be, but also people tell me how passionately they care about the work that they're doing, how they work with people and see people's journey towards recovery as being something that makes a massive difference to their professional and personal kind of lives. And so telling those stories, articulating those experiences, in terms of being able to put those stories in front of people is going to be hugely important. And in that, we need to thank and work very closely with the existing social work workforce who have those stories to tell and have those stories to be able to encourage and enthuse others to come and join them. This pilot is going to be very important. This piece of work will be very important. I'm a big fan of robbing and duplicating, as Andrew puts it, but I also know that in this area we will need to make sure that this adjusts to the very particular needs of working in this environment. This environment is a different kind of environment from the teaching environment. It's even different from working as a social worker with children and young people. So we need to make sure that this work recognises some of the very important challenges that prospective social workers are going to have in working in mental health services. I'd also like to see a couple of other kind of elements really brought to life in this piece of work. First of all, are we seeing the journey, the stories of people with lived experience very much at the forefront of the way in which we are now telling that story of mental health. In Time to Change, we're seeing thousands of people stand up and tell their stories about their own personal lived experience of a mental health problem. I think it will be really impressive and a key success indicator for me personally if this programme doesn't just attract great graduates into the programme, but it also attracts great graduates who have their own lived experience of a mental health problem, so that they can tell that story, can sit alongside the person they're working with, and can do so with that real authenticity to be able to be a part of that person's journey as they go through the care and support they receive. And I'd also really like and hope to see the role of the third sector, the voluntary sector, at the forefront of the way in which these programmes are being delivered. As you've already heard from Norman, we are moving to an environment where integrated care is being provided by integrated providers. And in this particular area, I think the third sector has a huge role to play. 150 local minds up and down the country support 300,000 people every year. Many of those people are working, and our staff, our 2,500 staff, are working inside multidisciplinary teams. So I think I'd really like to see this approach including the involvement of voluntary organisations to be a part of the solution for this, because I suspect we will increasingly see people moving from different kind of segments, if you like, of our sector. And in doing so, wouldn't it be great to give people that experience of working inside the voluntary sector as well? And there are large voluntary providers, some of whom are here in the room today, who I'm sure will want to be a part of this programme. And I think we should absolutely embrace that, whilst also making sure that the appropriate professional support is given to those people in their journey. So the final point I want to make is about paritative esteem. Now, Norman and many others have been real cheerleaders for this whole idea of bringing together paritative esteem between mental health and physical health, and not before time, in my view. But in many ways, one of those kind of acid tests to see whether we are going to truly achieve paritative esteem between mental health and physical health is in the workforce. For far too long, the mental health workforce has sat slightly as a poor relation of the physical health workforce, and I think that does the mental health workforce a great disservice. There are fabulous people who in this country today are doing terrific things working with people with mental health problems, and their commitment to this issue should be championed and recognised. But we sometimes need initiatives to really be able to shout about that from the rooftops and to bring that parity of esteem in the workforce back up to the level. And I really hope that this initiative will help to contribute to making sure that when a graduate starts to think about working in the health and social care field, that mental health is their top choice. Thanks very much indeed.